Hi guys, welcome back to the channel. Hope you have enjoyed your Sunday. Let's begin with the classification of impaction. Now coming to classification of impacted third molar, first is Winter's classification, that is radiological. Okay, it is based on the long axis of impacted tooth and that of second molar. Long axis of the impacted tooth and that of second molar. It can be mesioangular, distoangular, vertical, horizontal, buccoangular or buccoverted, lingoangular or lingoverted, or inverted. Okay, mesioangular, the most common one, accounting for 45%, vertical for 40%, horizontal for 10%, and the least common is distoangular, and the most difficult one, 5%. Now see in a diagrammatic form, mesioangular, this is the third molar, this is the second molar, so the third molar is tilted mesially, so it is mesioangular. It is tilted distally, so it is a distoangular. It is vertical, so it is a vertical impaction. It is horizontal, so this is the horizontal impaction. It is inverted, and this is buccoverted or lingoverted. Okay, this classification is clear. Now coming to the second classification. Second classification is of Pell and Gregory classification. It is based on three things. First is relationship with the anterior border of ramus. First is relationship with the anterior border of ramus or ascending ramus. To assess the amount of space between the anterior part of ramus or ascending ramus and distal to the second molar. डिस्टल टू द सेकेंड मोलर मतलब सेकेंड मोलर के डिस्टली और असेंडिंग रेमस के बीच में कितना स्पेस है उसको असेस करने के लिए हम ये क्लासिफिकेशन यूज़ करते हैं. ओके, फर्स्ट इज क्लास वन. Class 1 is space between the distal of second molar and the ascending ramus is greater than the mesiodistal diameter of third molar. Space between the second molar and the ascending ramus means this space. Okay, this space between the second molar and the ascending ramus is more than the mesiodistal diameter of the third molar. Okay, is more than the mesiodistal diameter of the third molar. Now coming to class 2. Class 2 is space between the distal of second molar and the ascending ramus is less than the mesiodistal diameter of the third molar. Is less than the mesiodistal diameter of the third molar. This is the mesiodistal diameter of the third molar, and this is the space between the second molar and ascending ramus. So this space is less than the mesiodistal diameter of the third molar. This space is more than the mesiodistal diameter of the third molar. This is Pell and Gregory classification. First one, the class 1, class 2, and now class 3. What is class 3? Class 3 is that all or most of the third molar is within the ramus. All or most of the third molar is within the ramus. This is class 3. All or most of the third molar is within the ramus. Okay, clear with class 1, class 2, class 3. This is Pell and Gregory. Now Pell and Gregory second told the relationship with the occlusal plane. Position A, on a level with or above the occlusal line. Position B, below the occlusal plane but above the cervical level of second molar. And position C, below the cervical line of the second molar. Coming to the diagrammatic representation, it is above or at the same level. Third molar is above or up the same level of the occlusal plane of the second molar. It is below the occlusal plane of the second molar but above the cervical line. Okay, and in position C, it is below the cervical line of the second molar. Hope I am clear with class 1, class 2, class 3, and position A, position B, and position C. This is Pell and Gregory classification. First for ramus relationship and second is for death. And third, he stated about the relationship with the Third is stated about the long axis of the impacted tooth and that of second molar. This is the Winter classification only. We have read Winter classification. Then there is Pell-Gregory classification. Pell-Gregory classification, he has divided the classification into three. First is relationship with the anterior border of ramus, that is class 1, class 2 and class 3. Second is relationship with the occlusal plane, that is position A, position B and position C. And third is long axis of the impacted tooth and that of second molar, that is only Winter's classification, meaning mesioangular, distal angular and so on. Okay? There are two recent advances in the classification. First is the classification of impacted mandibular molar within INB canal on CT. Mandibular molar or INB canal का relationship on CT. And second is Quek et al. Classification. Okay, we will dealing this both. First, coming to the classification of impacted mandibular molar with INB. So, first there is relationship with mandibular canal in buccolingual section. Class, subtype and scheme. First class is class 0. The mandibular canal is not visible on the image. We can see mandibular canal is not visible. Then class 1. The mandibular canal runs apically or buccally with respect to the root but without touching it. Means the cortical limitation of the canal are not interrupted. Again, class 1 is divided into 1A, 1B. 1A is the distance of INB and tooth is greater than the 2 mm and 1B is the distance is less. We can see it is running apically and buccally, but it is not touching the tooth. In both cases, it is not touching the tooth. It is more than 2 mm, it is less than 2 mm. Same coming to class 2. The mandibular canal runs lingually, here apically or buccally, here lingually, and with respect to the tooth without touching it. In both cases, it is not touching the tooth. Same way, 2A and 2B, it is greater than 2 mm, it is less than 2 mm. Greater than 2 mm, less than 2 mm. Now coming to class 3. The mandibular canal runs apical or buccal, but touching the tooth. In class 1, it is not touching the tooth, but in class 3, it is touching the tooth. In 3A and 3B. 3A, in the point of contact with mandibular canal, shows the preserved diameter. The diameter is still preserved, okay. But in 3B, it shows a small caliber and or interruption of the corticalization. We can see there is an interruption. It is in both the case it is touching the tooth, but in this case 3A, the diameter is preserved and either interruption ho chuka hai. Okay. Now coming to class 4, the mandibular canal runs lingually touching the tooth. In class 2, it was running lingually but it was not touching the tooth. But in class 4, it is running lingually and touching the tooth also. So 4A and 4B, same. Here the diameter is preserved, here there is interruption. Okay. Now coming to class 5, the mandibular canal runs between the root but without touching them. Again 5A, 5B, greater than 2 mm, less than 2 mm. It is not touching the tooth. In 6, it is between the root but touching them. Same, the diameter is preserved. Here there is an interruption. It's very simple. Now class 7, the mandibular canal runs between the fused root. It is the single classification, between the fused root. Okay, this is clear and this is very simple. Only 3 things you have to remember. First, it will touch the tooth or it will not touch the tooth. Second, buccal or lingual. And third, in subtype, we have to remember it is less than 2 mm or greater than 2 mm. Now, one more classification was given by Quek et al. That is angulation. The vertical impaction, the angulation is -10 to +10 degree. Mesioangular is 11 degree to 79 degree. Horizontal is 80 to 100 degree. Distoangular is -79 to -11 degree. See the difference, okay? And others is 111 degree to -80 degree. This is Quek et al. Classification 2005, okay? Now, we have read about all the classification. Now coming to radiological assessment of an impacted third molar. It is dependent on 7 to 8 things. Okay, first is type of impaction. We know mesoangular, distoangular, that is. Second is axis. Ease of axis is determined the inclination of radio-opaque line cast by external oblique ridge. Okay. Then existing pathology. It can be dental caries, cyst or neoplasm, hypercementosis, fusion of root, fusion of crown, PDL disturbances, first molar present or absent. Type of impaction, axis, existing pathology. Now there is thing called Warfare assessment and position, that is waterline. These two we will be dealing in detail in next classes. Now crown of impacted tooth, root of impacted tooth, age consideration we have already dealt in previous class, and relationship with inferior alveolar canal. All these we will be dealing in detail in next class. Till then, like, share and subscribe. Thank you. Bye.